Freedman Doc. Hello, how are you, buddy?
Hey, Ann, how you doing? I'm doing great.
I look at this guy. He's the greatest. You can see off the bat. First of all, thank you for calling me Ant, all right? Because that's how we do it here. And he's a
of
Princeton
course.
man.
Ooh, nice.
Proud of him. Look at that. It's fantastic. What'd you think of the draft, Doc?
Appreciate that. What do you? We all know how he did it again, right? We're feeling good.
You know what I love about this segment is that you guys are so knowledgeable about sports. Like, forget about doing God's work and repairing bodies. You guys know what's going on. Like, you guys are all about it. You guys are 4 for 4 guys, and I love it. Like, I love the fact that you guys know what's happening.
Yeah, absolutely. Big Eagles fan. Always follow it. Was that the Super Bowl? We're defending our world championship with this draft.
All right. All right. We were talking about this team could go down. Would you agree that the Broad Street Bullies, because we just lost Ed Van Imp, and the Broad Street Bullies were the most legendary team in Philadelphia, right? Like, they just lasted forever. This current Eagles team has a chance to be the greatest team ever in Philadelphia history.
Yeah, I agree. It's all going to be about consistency. If we can do it again over the next couple of years, there's no question. And I was listening to part of the segment earlier. The Broad Street Bullies were now 50 years ago, right? So you've got this, like you said, a whole new generation that's watching, and certainly for us, this team will go down better than the 2018 team. And, even though that was our first Super Bowl. So, yeah, I think we just if we can repeat the success, absolutely.
There you go, VG. Listen to Doc.
I hear him.
All right.
I hear him.
All right. So now, just as a precursor, we know that you're not treating Jihad Campbell's injuries, but we like to talk about them to educate the fan base on, we think about shoulder, we think about his injuries. Give us some insight into this, Doc.
Yeah, absolutely. Well, what we know is that it sounds like he injured his shoulder during that 2024 season with Alabama. He was still able to participate. We know he participated in the combine and then got it fixed, and he had a tear of his labrum. The labrum is the cartilage ring inside the shoulder where the ligaments attach. And in general, when somebody injures their labrum, it's because of some shoulder instability, that shoulder either partially or completely popping out of socket. Now, we never heard about him completely popping it out of socket, so it was probably like a subluxation where it partially popped out and he was able to continue participating and then required that surgery. But, the hope is that he's going to have a full recovery and be able to return without any difficulty.
Yeah, it's funny because we talk about labrum, and obviously for a pitcher, it's, very, very serious. For a linebacker, even though you're using your shoulder to tackle and you're leaning in, you can get past that, right? Like, that's something that long-term you should be fine with.
Yeah, I think it's much less likely to cause him a long-term problem. It's always possible that when you're tackling with your arm outstretched and you're reaching for a tackle, it's possible that you can have shoulder instability. And sometimes when somebody has a labral tear in the back of their shoulder, when they're like out in front and blocking, it can cause a problem. But overall, I think the feeling is that he's going to have a full recovery. I mean, we know that the reason his draft stock dropped is because of that injury concern. But, you listen to Howie Roseman talk, and he was really willing to take that risk. The medical staff is looking over all this stuff to make a recommendation. And there's a lot of history of these type of injuries with other similar players, and whether or not it's going to cause Howie Roseman talk, and he was really willing to take whether or not that's going to cause a problem. And so there's a lot of history there to know that he's likely going to do well. Now, one of the things you hear out of Howie, that they've been a little hush-hush about this, but it's likely going to take 4 to 6 weeks into the season before they really have him playing full time. And I think they're expecting that. And they're going to allow him time for recovery. And luckily, our team's got some luxury. Hopefully, if Nakobe Dean comes back and is able to play, there's going to be no rush to return him. And then we've got a prospect that's got several years of productivity that we got kind of at a steal in the draft.
How would you look at it, just generally speaking, because we always hear about the idea of draft and medicals, right? Because you guys will look at players and prospects and take a look at their medicals. What would give you pause long term if we're talking about, and this is just in general, the type of injuries that would give you pause that you would say, just be careful about where you would take this player? Would it be more knee?
I think it could be shoulder, knee, or something else. I think anyone who's had a recurrent injury, a lot of times you're worried, now they injured it a second time and they've had to have a revision surgery and it can be worse. I mean, my partners have been going to the combine for a long time and examining some of these players, and it's amazing some of the things that you see and what people can play through in football. So, a lot of times, some of these injuries that would sideline me and guys can really, really play through and do extremely well with. But if somebody's had, really, more extensive arthritis in their joint and at a young age, you're worried about what their longevity is going to be like. And like I said, a recurrent injury, but, so many of these people can come back. Look at Saquon. He tore his ACL several seasons ago and look where he was this year. And, there are certain small percentage where that can be a more devastating injury to get someone back. And I guess we're comparing something different. We're talking about a running back and we're talking about a knee, but I'm just saying, like, most of the time with a relatively straightforward injury, we can get people back to full strength and full ability to return. Especially something relatively straightforward like a labral tear. And, there's almost none of these athletes that get drafted without injury. I've had some opportunity to examine some of these athletes in the past, and there's so few of them that don't have an injury history.
I would think it has to be, especially when we talk about the level of college football you're playing, right? And you're for years, you forget, I think about baseball for a second. You got kids that have been throwing, right? Like from travel teams, high school, right? You're throwing constantly because you're playing fall ball, right? You have your season, you have off-season workouts. And now with specialty, you're using that body part constantly.
Yeah, absolutely. And we see it in baseball with overuse things. And, when you think about football and the number of collisions that you have playing at a high level, going from, PHLY to high school to this high level college that they're playing to get to the NFL. That's why, almost all of them have had some type of injury. The thing that makes this harder to predict is just because of the timing, right? Because, it basically was surgery after the combines. Now, all of a sudden people get nervous, but the feeling was, and, again, in hearing Howie Roseman talk about the team looking at the medicals was, hey, we're predicting this guy's going to come back full strength. And we're really going to get a high value at later in the draft.
I love Doc.
Doc, this isn't something that normally repeats itself and is a chronic thing. You can get it back and be good to go for a bit.
Well, look, with everything, there's a possibility, and there's certainly some possibility that he suffers a re-injury. But we have a lot of football players who even have, complete dislocations. They end up getting labral repair in the offseason and are able to come back very well, especially on the defensive side of the ball. It's a little harder if you're a skill position player. You could have a problem, and occasionally with throwers like the quarterbacks. But honestly, a defensive player at linebacker, he really should be able to come back, and especially if we play him, off the ball on the edge. I think he's going to do very well.
Cool,
love it.
Doc. Yeah, good news.
Yeah, will you watch the Derby?
Yeah, I'm going to watch it. we'll see what happens. I'm gonna have to, figure out. I don't know if I'm gonna drink any mint juleps or anything, but
You got to come down here one day, man. Talk sports and hang out with us. All right.
that'd be great. Thanks for the invite.
Would love it, Doc. Great stuff, man. You guys are the best. Thanks, brother.
All right, thank you.
Dr. Kevin Freedman, a fantastic doctor who knows his stuff, man.
Yeah.
What a great guy. I mean,